Wise Tribe, and welcome to this morning's Anju Asks. I'm here with Dr. June Tan Sheren from Osler Health International, and we're here to talk about a lesser talked about topic which has been taboo, has been sort of discussed within smaller groups of good, trusted friends. And I think now it's time to bring it out into the open. Wouldn't you say, Dr. June?
Anju, thank you.
It's something that we will most likely all go through as women. And I was actually quite surprised to hear that symptoms can arrive as soon as age 40. I mean, I'm 41, full disclosure.
Right.
I know nothing about menopause, also full disclosure. Fully unprepared. This talk is written for me. I don't know anything, want to know more about how to prepare myself, what I'm looking for, what could potentially happen, and how best to arm ourselves with information going forward. So you are known for working with women's health and menopause, and you've worked in Singapore for 12 years.
Oh, well, actually longer than that. I've been in practice for over 20 years now, working in the international community for over 12 years.
Wow, okay. So let's get started.
Sure.
What are some of the common symptoms of menopause that we should be looking out for?
Well, the menopause really is the final menstrual period that a woman will experience, and it is defined only when a woman goes through 12 months without a menstrual period. However, there is the perimenopause, which is that stage of life, that period of time leading up to the menopause, and that can last several years, most often starting from the age of 45, so you're not quite there yet, Anju, but good to know what the symptoms might be of the perimenopause. The two most common symptoms would be hot flashes or hot flushes, depending on which part of the world you come from. I might use them interchangeably as well. And also changes in your menstrual pattern. These are very, very commonly encountered. There are other symptoms like vaginal dryness, bladder irritability, fatigue. Many patients come to me saying they've got this brain fog all the time, difficulty in concentration, lack of focus, sometimes sleep disturbances as well that may come with or without hot flushes and night sweats. The sleep disturbances can come on their own. Mood swings as well is another fairly common symptom.
Wow, so how do you know if those things are linked to perimenopause, or if it's if you've still got your periods and you could still be experiencing some of those kind of hormonal changes and symptoms due to your normal hormonal cycle? How do you know that you're transitioning to perimenopause?
From the age of 45, if several of those symptoms are coming about, especially the hot flashes and the change in menstrual period, then you can most likely say to yourself that yes, these are very likely signs and symptoms of perimenopausal hormonal changes. With many of the other symptoms, Angie, you're quite right there, because there could be lots of other reasons contributing to mood changes, to fatigue, to sleep disturbances. So sometimes it's not clear cut. In fact, it's never clear cut.
Yeah, I'm just thinking about myself, and there are so many things that you can be triggered with irritability, and one thing feeds into another. Sleep deprivation makes you more irritable.
Exactly.
Something somebody does, or your time of the month, or so many contributing factors. So I guess, how can you track those symptoms? How can you piece what's going on together?
So what's useful to do, is to track certain symptoms such as hot flushes. You can keep a hot flush diary. There are some apps that facilitate that. There's an app called Balance that's quite helpful. If you prefer to go non-digital, you can do it the old-fashioned way. Just write down time of the day when a hot flush occurs. Note the severity of it. Be very useful to grade it. Maybe grade 1 for mild, moderate, and severe. and then note the duration of the hot flush, how long it lasts. And then very important as well to note any triggers, any associating factors that may have occurred just shortly before the hot flush came about, such as, was it a cup of coffee that you downed, or were you in a rush that morning, or were you just in a very hot environment that day? Was there a trigger associated? And if you can, just making a note of whether any techniques that you're aware of, and whether you were able to do something to abort or to reduce the hot flush. So that's a good diary to keep, a hot flush diary, so to speak. It allows you to track the pattern, the frequency, the severity, the triggers, and allows you to perhaps manage the hot flushes a bit better, just looking through the pattern of it.
So using that at balance you recommended, does that track a range of different symptoms that you might be feeling? So migraines, mood swings, you can track all of those things in the same.
That's right. I believe that's right.
Sounds really good.
I think you can track a few different symptoms.
Okay.
Yeah.
So if you are experiencing these symptoms, what can you do to manage them?
While we're on hot flush, hot flushes, which affects up to 80% of women going through the perimenopause. One of the most important things is to try to identify triggers, like I mentioned, a warm environment, coffee, cigarette smoking, alcohol, and rushing for time. These are triggers. Why rushing for time? That actually stimulates your sympathetic nervous system that drives up adrenaline, and adrenaline is a fight and flight hormone. Historically, a response that's meant to protect you from danger, but in this case it also brings up it causes vasodilation and therefore brings about hot flushes. So it's quite important to identify identifiable triggers and try to avoid the triggers. Controlling your environment, trying to stay in a cool environment all the time is important if you are experiencing frequent and severe hot flushes. Wear breathable light fabric, dress in layers. At night, have a flask of cold water by the bedside so you can take a sip of cold water when if you do wake up with night sweats and hot flushes. A very useful mind-body relaxation technique when hot flush occurs is the use of controlled diaphragmatic breathing. So when a hot flush occurs, it's very helpful to sit down, lean back, and what normally happens when we breathe is we take about 12 to 14 breaths per minute. If we want to try to bring that down to 5 to 7 breaths per minute, very simply by counting as we inhale through the nose, 1,000, 2,000, 3,000, 4,000, and then hold your breath at 5,000, and then start to exhale through your mouth. But at the same time, you're breathing not by expanding your chest or raising your shoulders. You are trying to push the diaphragm down. That's diaphragmatic breathing. You have one hand placed on the abdomen, and you need to feel the abdomen rise and fall as you perform the diaphragmatic breathing. If you're doing that for the first time, it's probably easier to lie down to do that, and then you can feel exactly that rise and fall. So this whole process of slow, controlled diaphragmatic breathing actually stimulates the opposite response, the parasympathetic response, which is the relaxation response. And this has been shown to lower the severity and duration of a hot flush, not just when it occurs, but if it's done twice a day for about 5 to 10 minutes, it actually reduces altogether the severity and frequency of hot flushes.
And that sounds like it's such a good thing to do, whether you're having hot flushes or not.
Yes.
Just to take a pause.
Absolutely.
I mean, if you can manage once a day, amazing.
Yes.
In awe. I think it's really good just to take stock, and that's what we're talking about: is tracking symptoms, keeping a log of what's going on with you. And I think so many of us are just caught up in the day to day and looking after everyone else.
Absolutely.
That it's a good reminder
to just take a step back and breathe.
Yes.
Yeah.
Okay, so we've talked about what the symptoms could be. We've talked about treating the symptoms. What about HRT?
So for women who suffer from severe hot flushes, HRT is known as the most effective treatment for severe hot flushes. HRT is hormone replacement therapy. It's essentially the replacement of hormones that have gone low in the perimenopause and the menopause, essentially estrogens and progestogens. And it has been well established to be the most effective treatment of severe symptoms of the menopause.
So it's not a standard treatment, you know, once you have passed your perimenopause and you are in your menopause, which is, as we said, 12 months without any period. It's not just a standard treatment for everybody.
It is not a standard treatment for everybody. It really is meant for women with severe symptoms, with debilitating symptoms. And of course, that can be quite subjective, but you know, what we want to achieve is to ensure that if a patient comes and says, look, this is affecting my quality of life, then we treat that seriously, you know, and that is significant enough, that is a reason enough to do something to manage the hot flushes better. There are also lots of other considerations. We need to look at potential risk factors that could increase the risk of complications associated with the use of HRT, and also a woman's preference, a personal preference as well. So it's not standard treatment because there are so many different variables with everybody.
Understand. So we did have a question from one of our members ahead of today about HRT. So she would like to know, is HRT prescribed in Singapore, first of all?
Absolutely.
It is available.
There are different forms of HRT, different combinations.
Right.
Yep, it is available.
So she was asking, is it, and I don't understand what these terms are, perhaps you can help.
Yeah.
Is it bioidentical or body identical? What do those two terms mean?
Right. Conventional HRT is readily available, and you know, lots of studies and research have been done on these various combinations. Bioidentical HRT refers to the use of compounds of HRT, of estrogens and of progestogens, that are supposedly closer to the hormone that your own body produces. Now, this, of course, has been touted to be more natural, probably maybe more associated with less complications and risks. However, the industry behind bioidentical hormones is not very well regulated at all by governments all over the world. So if you look at official websites giving information about the menopause, like the North American Menopause Society, the British Menopause Society, the Australasian Menopause Society, all of them recommend against using bioidentical hormones just because it is not as well regulated, not as well studied as conventional HRT.
Wow. Yeah. Okay, something to look out for. So, well, I guess that leads on to my next question. Are there any medical risks with taking HRT?
There are risks. 20 years ago, a huge study known as the Women's Health Initiative was published, and that found significant increased risk of breast cancer with the use of HRT, and it led to a severe drop. It led to a lot of fear, led to a severe drop in the prescribing pattern usage of HRT. In fact, more than 60%, there was more than 60% of a drop in the use of HRT, which has led to, you know, in fact, women suffering from a poorer quality of life for many years. Very importantly, over time in the recent few years, there have been some much higher quality studies done on the risk of HRT and even reanalyzing past data. And the latest studies have found that if HRT is used for less than 5 years in a low risk population, which is actually for most of the population, for women at low risk of breast cancer, then the risks of breast cancer are in fact not significantly raised at all.
Okay.
Yeah, so it's important when we assess and we evaluate patients with symptoms and we look at the suitability of the use of HRT that, yes, risk assessment essentially, you know, making sure that there isn't a significant family history or past history, whether you're up to date with the mammogram screenings, that's all very important. But it's important to know that the latest studies show that generally the benefits outweigh the potential harm in most women if HRT is used for less than 5 years.
Right, and I guess if you are going for your regular medical checks and you're checking in with your doctor, they'll be able to keep an eye on your levels of hormones and whether you are in that category of needing it, and then discussing the best options.
Exactly.
So again, talking about preparation and checking and tracking, are there any medical checks that you would recommend before you're heading into perimenopause, menopause? What can we do to identify where we are on our own health journey in anticipation of what lies ahead?
Now, it would be useful to remember that the menopause does not need to be diagnosed through blood testing. No investigative tests are needed to diagnose the menopause, as long as a woman is experiencing suggestive symptoms from the age of 45 on. Prior to that, hormonal testing is generally not very useful either in telling us, where we might be at that stage. But the routine things like your cholesterol checks, blood pressure checks, diabetes screening, any other health screens that may be relevant if you have a significant family history, for example, heart disease, cancers, getting your cervical smear tests done as a routine, breast checks before you reach the age 40, before you get to where you need to start mammogram, just regular breast clinical examinations by your doctor. So routine things are recommended.
Okay, that makes sense. 2 more questions before we have to wrap up.
All right.
Another one from one of our members in the audience today. She's talking about when you are experiencing menopause, and one of the symptoms that she, as many others, experience is the menopause midriff. The stubborn belly fat that kind of sticks there, and no matter what you try to do, just will not go away. What can we do about that?
All right. It's maybe useful to understand that with hormonal changes, there is a shift in body fat composition, and unfortunately, yes, a lot of it does go to the midriff. What can we do about that? I think it's important not to be obsessed with numbers. I think it's important to take stock and put in the exercise, put in the careful diet, but all with a holistic approach to it, that it's meant to keep you healthy, that your nutrition is balanced, you're doing a good range of exercise that includes cardio, flexibility, resistance, and not be obsessed with that number on the scale, and just understand that yes, there is a shift, a change in body composition, but aim for living healthily, cutting back on alcohol, cutting smoking, or even starting to think about quitting smoking. All these will matter and will benefit you in the long run.
Making those important lifestyle choices and decisions,
absolutely,
which menopause or not,
yes,
are going to benefit your health.
Exactly, absolutely. Whether you are suffering from symptoms of the menopause or not, these are all important lifestyle choices.
Yes. Okay, my last question, and something that concerned me a lot about menopause. I was talking to a friend last night about it who has been experiencing symptoms for over a decade. And the thing that she overwhelmingly finds irritating is the loss of kind of sharpness in her brain. And I've been listening to podcasts and reading around this topic of brain health associated with menopause. And, the way that she advised me to get through it when the time comes, is to make lists and just, grab hold of as much information as you can. So my question is, what can I do now to train my brain or improve functionality, cognitive functionality, to kind of hold on to that sharpness for as long as possible? So I don't want to be one of those forgetful people.
I think the digital world these days, unfortunately, is making us all a little lazy, a bit laid back, and gives us excuses not to work our brain cells very much anymore. So being cognizant of that, and just putting in an effort to keep ourselves active all the time, not just cognitively but physically as well. That's a good question as well, because it has been HRT has been researched into as to whether it may delay the onset of dementia, and so far results have been inconclusive, but it's all ongoing. But no, so far there's nothing to say that it benefits or it could harm. But that would be an interesting one to watch. But yeah, I agree with you, Anju. I think altogether we've just got to make an effort to keep ourselves cognitively challenged and active all the time.
Yes, reach for that puzzle book. What is the process for getting support? So we talked about checking in with yourself and figuring out if you have got new symptoms, different symptoms, trying to piece a story together, keeping track of things and trying to manage symptoms as well. If we feel that things are escalating and these symptoms are too much to manage and getting more, what's the process for support?
I would say that if there are symptoms that are starting to become a concern, that are affecting your quality of life, then really you should touch base with your trusted GP. It's all well and good if you have a gynecologist to go to, but really women's health is not all gynecology, and it's your trusted GP who usually has a more holistic approach to understanding your needs and providing that care. There are, of course, lots on the internet, lots and lots of information, but you need to be very careful about what you read. I do have a list of several very useful resources, like I mentioned, from the North American Menopause Society, the British Menopause Society. We have that on a fact sheet, and we'll be happy to send that forward to anyone of you. In fact, if you just email our clinic, Osler Health, we'll be very happy to share that fact sheet with you, which has a list of very useful internet resources.
Yes, I think we're going to share that in the post with this interview. So you'll be able to get Dr. June's contact details here at Osler Health International, and we'll share the link to the fact sheet as well, just giving you a little bit more information, background resources to read up and inform yourselves on the way forward.
Absolutely.
Thank you so much for your time today, Dr. June. It's been really informative. I've learned a lot, and I have to say my mind's a little bit more at ease, that it's not
good.
some kind of monster that's just going to appear out of nowhere.
Not such a big mystery altogether.
Yes.
Yeah.
Yes, thank you very much.
Thank you,
really
Anju.
interesting.
Thank you. Pleasure to be here. Thank you for your time.
Thanks, everyone. See you next time on Anju Asks.